Dr. Veer Pushpak first. Doctor, first tell us more about this dual vaccine. It tackles the original virus as well as this newer variant of the virus.
Yes, absolutely. Thank you for having me on the show once again. So this vaccine is known as SPIKEVAX. It's a version of Moderna that has a bivalent, as you said, dual variant vaccine, which has the original COVID virus as well as the Omicron virus. And the reason that this vaccine was released was because in the last 8 months, we've had about 3 major spikes in the United Kingdom. One was back in January 2022, one was in March, and then one was just last month, where we were seeing up to almost 150 to 300 deaths a week during those spikes. And most of those spikes were due to the Omicron variant that has spread very faster in the UK population. Obviously, the death numbers and the case numbers have decreased since most of the population is boosted. We've given about 120 million doses of vaccines throughout the UK population in the last 1 year. Since COVID started, we've given a total of 40 million first doses, 40 million second, and 30 million third doses of vaccine. But that booster dose was about a year ago, and so the immunity and the protection that those vaccines provided is going to start to wane, especially when it comes to the winter surge and the autumn surge that is going to take place in December and January of the coming year. So to protect the population from that surge, this vaccine has been released and quite quickly approved by the JCVI, which is the Joint Commission for Vaccines in the United Kingdom.
Right, Dr. Suresh Kumar
Gupta, in this, what we are seeing right now, this vaccine is meant to generate a good immune response against Omicron subvariants BA4 and BA5, currently which are dominant in India. How soon can we have this updated version?
Well, I hope you get it soon, because I think I heard Mr. Poonawala on your channel saying not too long ago that in about 6 months they will have an Indian vaccine that is similar to the one that Moderna has released in the United Kingdom. And I think it's very important. And one important thing to understand is that these bivalent vaccines are not a new thing. You know, in the flu season, we give flu vaccines which have multiple variants in it, so maybe about 4 to 5 variants. And the whole reason we mix the variants is so that there's a better immune response in the patient, and the patient is able to survive that different types of variants of the virus and not get into the ICU, not die in that process. Obviously in the NHS, the main priority is to stop that winter surge from happening and putting us more under pressure than we already are. The devastating effects of the virus are being seen now when the cancer surgeries, cancer diagnosis, all of those things are being delayed months because of what happened last year. And I think that the effects of the winter surge will only worsen that. So we need to be proactive, and that's why this vaccine has been released. And hopefully in India, according to Mr. Poonawala, it will be released in about 4 to 5 months.
Right, and finally, Dr. Suresh Kumar.